it's me again, Trisha Gutierrez, and I'm back here at CSA Medical Aesthetics. So last time, I got the silk peel treatment with the Lace MD machine, and right after the treatment, I immediately noticed that my skin was glowing, and even days after that, napansin ko talaga that the discolorations on my skin was fading. So I was really happy about that, but now I am back because I have breakouts on my chin and jaw area because I am a frontliner. So my skin was irritated and I am about to receive the treatment Botulinum Toxin injections to control the oil production of my skin, and I'm really hopeful that this works kasi nakakabawas talaga ng confidence and nakaka-conscious if your skin is not healthy. So I'm really happy and excited because it's the first time that I'm hearing botulinum toxin injections for the control of oil production on the skin. Usually sweat lang sa palms or sa underarms, but I'm really excited to try this out. Please like, share this video, and subscribe to our YouTube channel, and click the notification bell beside it to be notified whenever CSA Medical Aesthetics posts a new video, and to, of course, also follow us on our journey. See ya!
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. Have you ever heard of Botox being used for the treatment of oily skin or acne-prone skin? In today's episode, we will present to you a so-called microtoxin intradermal technique using Botulinum Toxin type A. And let's welcome Miss Trisha. Welcome back.
Hi!
Yan. So, how are you?
Good.
Okay.
Excited actually.
Yan. So, actually, I asked Trisha, have you ever heard of a treatment for acne-prone skin or oiliness using the injection of Botox?
No.
Never, right?
Never. I actually asked her about it.
And you told me that you only know that it's being used for the treatment of like sweating on the axilla, okay, or on the palms, okay? So that's the only one you know, right?
Yeah.
So, I'm with Dr. Ninya, and I think Dr. Ninya had already heard about it, right?
Yes, Doc.
So, in one of our conventions, okay? So, right now, the Botox treatment is also indicated for those people with too much oiliness and leading to development of the acne.
Yes.
Yeah. Because they said that the mechanism of action, it's able to block a certain receptor.
Yeah, receptor on the follicle, no?
And the sebaceous glands. Okay, and they specifically mention it's a nicotinic alpha receptor
Right.
on the sebocyte,
Apa.
thereby reducing the sebum production. Okay, so if you're having this oiliness, it will lead to having acne problems, right? Too much or excess sebum production can clog the pores. Okay, and actually I want to add, not only the sebum production it controls, but there's also this benefit of the pore size reduction. So for those having large pores, it can also tightly close that. And they were saying that it's due to this inhibition on that erector pili muscle, remember?
Yes.
So it will lead to the skin tightening. And of course, there's also this collagen synthesis. Okay, and another thing, because of that collagen formation, it can also give that skin lifting effect. Okay, so I'm mentioning already 3 benefits from it. Yung sebum production will be reduced, yung pore size being minimized, and skin lifting. Okay.
Because of the collagen synthesis production.
Right. And actually, they have shown a lot of mechanism of actions of this toxin being injected via intradermal layer. They said that it will inhibit some of those acetylcholine receptors, inhibiting those peptide release, all those molecular events happening in the dermis layer, even stimulating the fibroblast cells, or even reducing the keratinocyte activities. So we're very medical here, we're very scientific. A lot,
There
okay?
are lots of mechanism of action.
Right. And there were papers that were published regarding this effect. Because we only know Botox for wrinkles.
Opo. Fight
Right.
wrinkles or reduce the dip wrinkling.
Yeah. Because they have been approved for management ng mga dynamic wrinkles, yung sa upper third of our face, yung sa forehead wrinkles, glabella wrinkle or frown line, crow's feet.
Crow's feet.
So we have another indication for it. And we had presented before the masseter reduction also.
Yes.
Right?
We're having a V contour. No?
Yeah, Botox dito. And also for the alars tox.
Yeah.
And also the arm tox for reducing,
Or the arms. the towel.
yeah, relaxing your arm muscles. And calf tox dun sa legs.
Yeah. Barbie legs naman.
Barbie legs, exactly. So right now, it's a good thing that we have this use of our botulinum toxin specifically for the problem on oiliness on the skin, and also the concern on large pores. And Trisha, of course, hormonally speaking, we women still get acne, right? So we wanted to control also the acne formation. That's why we have to help Trisha. And of course, she mentioned a while ago about the use of the
Face mask.
Face
no?
mask.
It's a trending topic of
Right.
having mask nowadays. No?
maskne.
Even us doc, no?
Exactly.
We're having that
We're getting
maskne
that.
problem.
That's why we have to do something to manage this problem. So I think this is a timely topic.
Yes.
Okay?
Very timely.
Alright, so we will show the actual treatment when CSA Medical Aesthetics return. And we're back, mga ka-CSA. So we are now at the part of showing you the actual procedure for our so-called microzeumine intradermal injection. So we'll be doing a so-called assessment as well as landmarks, okay, in the injection of our botulinum toxin type A. Okay, so looking at the frontal view of Trisha, okay, target area that we need to treat will be the forehead, the lateral canthus, anterior medial cheek, the lateral part of the face, mandibular line, as well as the chin region. So, okay, so this will be our protocol for this intradermal technique. So from the forehead region, we wanted to do micro injections. So we will be having about 10 injection points. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So take note, this is intradermal injection. So the plane will be in the dermis region. So we are not doing intramuscular. We are not treating the frontalis muscles on the forehead. It's just the dermis layer where you have those sebaceous glands, the ones you wanted to target when you're doing control of sebum production. Okay, so for the lateral canthal region, so we have 3 injection points for each side. So we have 1, 2, 3, and same thing on the other side, 1, 2, 3. Okay. Now for the anterior medial cheeks, so we can use another point marker for that. So we can make columns of injection points for our anterior medial cheek. Okay, I can make, for example, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So same thing on the opposite side, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Now for the lateral aspect of our face. So we can do 2 columns. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Same thing on the other side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Now for the mandibular line, I can also make 2 columns of horizontal or 2 rows. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Same thing on the other side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And our mentalis region, 2 injection points. As to the amount of how much to inject, for the forehead region, the entire forehead region should only total 2 units only. For the crow's feet or the corners of the eyes, 5 units per side. For the anterior medial cheeks, 5 units per side. For the lateral, 10 units per side. Mandibular, 20 units. And the mentalis, 2 units for every injection point. Okay? So we'll now show the actual procedure. So we have reconstituted a 1 vial of our Xeomin with 5 ml of our saline. So we're going to start on the forehead region, and we have to inject a total of 2 units only for the forehead section. So our technique is via the intradermal injection technique. So your needle and syringe should be in a 15-degree angle. So injecting on the forehead region. So I'll be giving only 0.2 ml of our Botulinum Toxin. Okay, so the idea here is to create a blanched wheal or bleb. So again, it's intradermal, so we have to create this blanching effect. So no worries that it's gonna go into the frontalis muscle, because we are only injecting 0.2 ml or 0.2 units of our product, and it's very minimal dose only. Okay, again, it's intradermal, so you have to go into the dermis part. So the lines on the forehead region, we follow the horizontal crease where you want to place your 0.2 unit of your Botulinum Toxin. So I'm on the forehead region, so it's just creating this tiny bleb with blanching effect. So there you go. I'm done with the forehead. So we're going to treat the right lateral aspect of the face. So we'll be using half unit for every injection point. So I'll make 2 columns here. So half unit for every injection point. So the idea is to create a tiny bleb or a wheel formation here. So it will be about a total of 20 injection points. So again, you are in a 15-degree angle. So half unit for every injection point. Okay. So make sure you create these tiny blebs on the skin, or there's this blanching effect. So I'm almost nearing the last 4 injections, and my last 2 injections. There you go. So I use a total of 10 units on this side. So proceeding to the lateral canthal region, or the so-called crow's feet. So for this side, I will be using a total of 5 units. Okay, so the first injection point we need about 2 units of that. Okay, so the first one here, I'll be injecting 2 units here. So that's 1 and that's 2. Okay, and then lower to that is another 2 units. So we have 1 and a 2. And inferior to that will be just 1 unit. Okay. There you go. Now for the anterior medial cheek on the right side, we need a total of 5 units. So for every injection point will be half a unit. So I'll be making about 3 to 4 rows of injections here. So half unit here. That's the second. And then a third. And then fourth. And fifth. And our sixth. And our seventh. And the 8th, then the 9th, and the last one for our 5 units here, 10th. And then we proceed to the mandibular line. We need a total of like 20 units for the mandibular line. So actually you can target also the so-called platysma muscle there. You wanted to give a tightening and a lifting and a firming effect for the mandibular line. So we also use this mandibular injection intradermal for skin lifting and tightening. So I'll be needing a total of 20 units for that. So for every injection point, I can use my 2 units already. Okay. So the jawline region here will make 2 columns here. So I'll be giving a total of like a 2 unit here. Two units there. Another 2 units here. 2 units. 2 units. 2 units there. And 2 units there. So we need another 10 unit. That's a total of a 10 unit. So again, for every injection point on the mandibular line, 2 units for every injection point. So I need another 2 units here. 2 units there. 2 units. And the last one, 2 units here. There you go. So we have done the right side of the face. We'll also continue with the chin. We can actually also relax the mentalis muscle here. You can do 2 techniques here, intramuscular and also intradermal. So for our intradermal, you can actually inject intradermally about a unit here. And another unit there. So that's for the superficial mentalis region. Now you can also inject the mentalis part, the intramuscular region. So injecting your mentalis, you can use your 2 units here. And another one here. So we wanted to reduce the size of the mentalis. Okay, so we'll proceed to the left side. Okay, same thing on the left side. on our intradermal injection using our Botulinum Toxin. We will continue our discussion when CSA Medical Aesthetics return. And we're back mga ka-CSA, so we'll show the outcome of our procedure to Trisha. So what happened with her face after all those multiple injections. Okay, so she could just see that there's no actually bruise nor any like bizarre looking face right now. So it's expected to only have those blebs or tiny wheal from the injection. Exactly. So in a little while, those blebs will just go away. Okay. So we did this series of injections of our Botulinum Toxin type A, and the goal is for the reduction of the sebum production, as well as also for pore minimization and skin tightening or lifting. So we did a dilution of our Geomine or Botulinum Toxin type A with about 5 ml. So there's the proper dilution that we use. So this is indicated only for the intradermal injection technique. Alright? So any questions, Miss Trisha?
What are the possible risks with botulinum toxin injection?
Actually, Trisha, number one there, yung problem that we receive is the pain while doing the procedure. Okay? Some people are asking, is that painful? Because we use a lot of needle injections, right? So, of course, we did numbing of the skin with our topical lidocaine. So we left it for about 45 minutes.
Yes.
And then we have this cold machine cryotherapy. Actually, you can have your patient take some pain medications before doing the procedure. Like for example, NSAIDs, mefenamic, or even Arcoxia, or any other pain relieving medicine. Okay, so that's actually yung number one, yung pain. The others naman, number two, they were saying na I'm not responsive anymore. In addition pala, another input, I don't respond anymore to the Botox because there were reports of non-responders. Like people who constantly do injections, they found out that over time, you can develop resistance. It's just like any medicine when you're taking it always, like antibiotics, then time will come, you don't respond anymore to that medicine. So with this or the botulinum toxin type A, so there were reports of those non-responding anymore. Like for example, even aesthetic indications, like for injections of the lines, dynamic wrinkles, or even yung mga muscle reduction there.
Effective sa kanila, Doc, no?
Yeah, there were reports actually, they had published papers on that, na there will come a time na we don't respond anymore to that medicine, to that brand. So the good thing is, we already have right now a specific botulinum toxin type A that's free of complexing proteins, and they did a study on it also that it doesn't develop resistance. So this type of botulinum toxin type A is pure, it's free of complexing proteins, so no development ng mga antibodies or neutralizing antibodies against that neurotoxin or botulinum toxin type A. So that's another thing. Ano pa bang iniisip mo? The others naman, of course, sometimes, siyempre, injection, some will have some swelling, bruising, pinpoint bleeding, related to the use of the needle techniques. So, mga ganon. Or yung others, you might be thinking na baka sa muscle mo ma-paralyze. Okay, take note of this, we did injections sa mid-face. So, we wanted to avoid injecting the zygomatic muscles, the muscles that will elevate your upper lip. Yun yung responsible for your smiling. So, we only go into that depth, the dermis only. Kasi when you go deeper na, muscles na yon, then you're paralyzing your muscles. So, with this one, we're not paralyzing the deeper muscles. So, it's very safe. So, no problem naman doon. Okay? Baka worried si hindi na mag-smile. So, the right technique, proper technique, proper depth, intradermal depth, proper dilution of our product, and of course, with our patients, we do assessment as well. That's very important. Nasagot ba?
Yes,
Yes.
po. And I also have another question. Is it safe to do this procedure even if I have active acne?
Yeah, actually the goal of our treatment right now is to really also control acne formation. They did also have a report with the mechanism of action. So you're targeting sebaceous glands. So which is
Or
actually
the oily face.
or the oily face, which is one of the pathogenetic factors for acne formation. The overproduction of the sebum. And another thing is the keratinocyte activity, which is also a culprit for the acne formation. So we're targeting factors causing acne. So even if you have active acne right now,
Yeah.
so we did injections in the intradermal section. So of course we still have to treat your active acne right now. We'll be giving you topical creams, anti-acne gels to control the acne as well. And for the case of Trisha, kasi there's a component of hormonal.
Yeah.
So that's another factor we have to take into consideration. So this can be combined with as management for those with active acne.
Opo. So
Okay.
medications plus this Xiomin property.
Exactly.
Very
So another input, actually with this kind of intradermal technique, it's not same as the intramuscular effect of in terms of longevity. How long will it last? So when we say, diba, when we do Botox injections, we tell them that 4 to 6 months.
Yes.
But this one, because it's intradermal depth and we have like higher dilution, usually they're being advised to repeat it in 3 months time. And it's indicated for the younger ones, like early 20s to late 30s. And ako, late 40s, I think, pwede pa. No, because the reason 20s to 30s having this active pimple formation, that's one thing that they have reported also.
And this age group kasi they have this oily faces talaga.
Yeah,
No?
right.
They're
So
very
for my
active.
case, I need it for my wrinkle treatment.
Yes.
Okay. Any other question?
Okay na.
Are we learning?
Yeah, I learned a lot.
Yeah. Doctora, inputs.
If you want, yun nga, no, we're having this Xiomin injection. It's zero complexing proteins po. Very safe and effective for this technique and also for the wrinkles, wrinkle production, etc.
Yan.
Yun.
And any message sa ating mga televiewers? Miss Trisha.
Thank you for joining me in my journey,
Right.
and I am so excited to show you the results. Actually, as of the moment, I can already see yung pores ko mas nag-tighten na
Right,
sila.
yes.
So I'm so excited to show you the results after maybe 2
Yes,
weeks.
we'll still do a follow-up. So
Yeah.
we'll have another episode for Trisha. So that's another thing actually. Some cases, they were reporting that after doing the intradermal technique injection, they can see already some tightening of the skin and closing of the pores. So that was the report also. Okay, so kung meron pa po silang katanungan, you may email us at csaskinclinic@yahoo.com. We also have our FB page, CSA Medical Aesthetics, our Instagram, CSA Medical Aesthetics. Our clinic is located here at the Cluster I, Unit 1 of the Infinity Shop, Francisco G. Nepomuceno Avenue, Pulong Maragul, Angeles City. Contact numbers 0933-860-9193 or 0917-504-4268. So our other videos, you can see them at our YouTube channel, Contessa Salvador. So thank you so much. Thank you, Trisha. Thank you, Dr.
Thank you
Alina.
din, Dr.
God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.